Williams is fantastic. We started out using them for all of our big cases. I had worked with another lab for probably 10 or 12 years, and when I switched over to Williams, we were having issues with the previous lab getting the quality control. It was just going down. I switched over because a couple of my friends were using them, recommended them, and actually when I switched, I had decided to have new veneers done for myself, and my friend, the dentist who did them for me, used Williams and Bob, and he's like, I'm going to do your veneers, and I really want to use, Bob Clark at Williams Dental Lab. And I was like, great, that's fine. I normally use, so-and-so, but that'll be fine. So actually the first work I got from Bob was in my own mouth. I've worked with several other laboratories that do major work. I've done a lot of cosmetic and rehabs for 20 years. And I've had other lab technicians and other labs that have given me great products. And I still have relationships with some of them. The two big things really that I feel sets Williams apart in my mind is the lack of adjustments on my cases to start with. Everything just fits. It's very, very rare that I have to make any changes when I get my cases in. I check them on the models, they fit. I put them in the mouth, they fit. I bond them down. And it really is a rare occasion for me to have to make an adjustment, which is a huge thing for me from a time standpoint and from a validity with the patients, that they see that I didn't have to work on that stuff after it came back in. The second thing is, I've heard all my life from laboratories, we need 10 working days in lab to get this done. In one lab it was at the point to where if you do a combination case, we need 7 days for this, and we need 6 days for this, and we need this and this. And 3 or 4 or 5 weeks later, you get your case. And they acted like it was just a huge thing when you needed something rushed a little bit. And again, I try not to take advantage of it, but I don't know that Bob and Frank even know how to say no. You ask them to get something done and they're like, okay, let's figure out a way to get it done. And so, not that we rush all of our cases, we try to give them, their 2 weeks or however long they need normally. But if I need something, they make it happen. If I need a remake, they make it happen. If I have a patient that's getting ready to leave in 3 days and I need something done, we're all in the same customer service business.